The sound will be good enough.
Yeah, I did it from in my office. Just speak, loud enough.
Okay.
But I did it in my office, like about that distance away, and then played it back and could hear it just fine. All right, my name is Stan Atkins, and I'm interviewing Colby
Razia.
at Skagit Domestic Violence and Sexual Assault Services. I know that you signed the informed consent form, but I just would like to discuss the purpose of this interview is for my clinical interviewing class, final project, discussing victim advocacy. Do you mind if I take notes during this?
Go ahead.
So what led you to Domestic Violence Victim Services?
I think for anybody, well, not anybody, but most people working in this field have some sort of personal connection to it.
Mhm.
So there's definitely that aspect where as a young person I witnessed domestic violence in some relationships that I saw and sort of formed a realization on the importance of healthy relationships, and then had my own personal experiences with unhealthy relationships and really solidified my feelings in terms of wanting to work for a cause for the betterment of relationships and just to expand my personal knowledge on healthy relationships. And then when I started going to school and experiencing human services, I just kind of got into this field through practicum experience, and it really just felt like the place I was supposed to be.
So by practicum you interned
Yeah,
here?
I was an intern here for 2 years while I was at Skagit, and then went away from this for about a year while I went to school at Western to work on my bachelor's degree, and then they kind of called me back and were hiring for the position I used to intern under and asked if I was interested in applying, and so here I am.
What position was that?
Education and Prevention Coordinator.
And so that's your current position here?
Yes.
Is what does that job include?
Education and Prevention Coordinator is a lot of community outreach. A lot of my job is being out in schools, at community events, sort of being a face out there, trying to get as many people sort of connected with us and knowing that we're a community resource as possible. It also includes kind of the same as most of the positions here, where you also are an advocate. You take a hotline shift, you work with clients in office, providing advocacy, legal advocacy, medical advocacy, all those sorts of things.
So you work direct face-to-face with actual victims of domestic violence,
Yes, pretty often.
as well as community outreach?
Mm-hmm. Yeah, mostly I'd say my job is, my priority is community outreach, because we have advocates that are specifically here to just be advocates. So when I have the opportunities to go out to the schools and to have presentations and those sorts of things, that's sort of the top of my list. But realistically, there's a lot of downtime in that, whether schools are on break or you just don't have a presentation that day. And so then, providing just advocacy to clients becomes the priority.
Mm-hmm. What does initial contact with victims look like? Like, how do you come into contact with them most of the time?
A lot of times the initial contact is through the hotline. I think for people who are going through this type of situation, for a lot of them, the idea is easier to first just call and see what can you guys do for me, what services do you offer, and having that preliminary conversation on the phone. And a lot of times that'll lead then to somebody coming in or asking for medical advocacy or legal advocacy. Occasionally we'll get walk-ins, but usually it starts with the phone call and kind of works its way from there.
And so all the advocates here work the hotline?
Yes, all the advocates here work a hotline shift per month, or it's a rotation.
Mm-hmm.
But and then we have multiple hotline phones to sort of make sure all the calls are caught. So there's always kind of 2 people and sometimes a volunteer interchangeably answering the hotline.
So kind of like a chain, so that potential victims don't get missed?
Right. So like for us, it goes, when somebody calls, it'll ring first at our shelter, because a lot of times there's a shelter staff on, working, and then if it doesn't answer there within a couple of rings, it goes through to the volunteer cell phone if that's being used, and then the volunteer cell phone goes to hotline 1 and then to hotline 2. and if still for some reason it hasn't been picked up at Hotline 2, it just recirculates and starts over until somebody answers. But of course our goal is to answer within, as soon as possible, because eventually somebody would not hang on the phone that long.
So I'm currently training to be a domestic violence perpetrator treatment provider at Skagit Recovery Center, and when we meet with a abuser or perpetrator, we get a release of information for you guys, for the victim, and according to my supervisor, we send a release of information for the victim to you guys. Do you ever deal with victims from that angle?
Not necessarily, as far as I know. I think mainly because in that essence, we generally won't contact a victim until they've contacted us and then given us permission to continue to contact them or whatever. But we usually won't make the first point of contact because in a domestic violence situation that's not always safe. You never know what their circumstance is, if their abuser is still around them, if calling could get them into trouble, if leaving a message could get them into trouble. So usually we don't make a point of contact until they contact us, generally speaking.
And that's for the purpose of victim safety?
Yeah, victim safety really is the main reason behind that. And confidentiality.
Yeah. Have you ever had an abuse? Sometimes when I'm working with perpetrators, I notice that they try to take the victim role. Do you ever have victims come who are actually abusers?
We have had that. It doesn't happen often, but we're trained on that, and it has occurred. It's hard to sometimes know. A lot of times because there's sort of the ideology that women are the victims and men are the perpetrators. We'll occasionally get men who call who are claiming to be a victim, and it's well, we serve men as well. I've noticed that sort of gets more of a kind of question mark around it from a lot of the advocates, and it's not as if they don't provide the same level of service or anything like that. I think it's just more kind of asking the questions to try and make sure that this person really is a victim and not an abuser. And also in some cases we talk about same-sex relationships, in particular women, because we have a shelter that provides services to women. And so we always want to be careful if we have a client who is in a female-female relationship, careful that we don't end up providing services to both sides of the relationship, and that goes for any relationship. We really just want to be working with one side, not both, in that term.
And that's again probably to ensure victim safety as well and confidentiality?
Yeah, both.
How big is the shelter that you have?
Shelter we have is, let's see, I think it's like 30 beds now. It's sort of being renovated and changed around, but I think we're at 30 or 32 beds. Some of those are like shared rooms and some of them are single rooms, and it depends on if there's kids and that sort of thing. We always try to give families their own room, so sometimes that means leaving a bed open if it's just a mom and a kid and it's a 3-bedroom. But if we can, we like to try to give that privacy. But we can go up to I think 32 people.
So that facility accommodates families and
families in terms of mothers and children. It's not, we don't have a shelter option for men, so it's just for women and children. And yeah, just for women and children.
So what happens in the case of a male victim?
We can provide services as far as advocacy goes, and we can try and get them set up with some sort of services if they need shelter that offers it for men, but we don't offer that through our agency. And that's one area where it is hard to find that. It's not very easy. There's not very many places that offer that sort of service.
Yeah, what is the ratio between male and female victims you see? Do you see very many male victims?
Not nearly as many as female. I've seen, in a few years of being here, I've seen maybe 2 or 3, and I couldn't count how many female victims I've talked to or worked with, so it's not nearly as common.
So change gears back a little bit here to your job description. So not really your job description, but as an agency, are there other agencies in the community that you work with?
We do a lot of outsourcing in terms of resources and getting people set up, because a lot of times, there's co-occurring issues around domestic violence. There can be alcohol and drug problems, there could be homelessness, there can be, any number of things. And so we work with other agencies around that sort of thing. And we also work with other agencies in terms of sometimes if we get people calling on the hotline or clients who maybe aren't necessarily domestic violence victims, trying to get them, instead of just saying, oh, we can't help you, trying to get them set up with somebody who can help them. And that's especially true, I think, of homelessness.
Okay, so we're running a little short on time. I'd just like to summarize kind of what we talked about. We started off discussing your role here and how you got into working with victims of domestic violence. We discussed advocacy and the hotline and the chain so that clients don't get missed, basically. We talked about victim safety. It seems one of the priorities of your job is to provide victims with safety. Discussed victims and working with perpetrators and avoiding contact and dual-sided relationships, and agency affiliation. So you seem to refer other services in the community as well, not just working with domestic violence, even though that's the priority.
Right.
Well, thank you for your time.
Thank you.
Thanks.
Yep.